Hi guys, this is Dr. Bhupesh once again from Dr. BKM OET Institute, and I have already recorded one visit letter. I want to do all the letters when you have exam tomorrow because again any letter can come. But yeah, I think visit letter can come. So I have covered that in the previous video. I will put this video on as well. This is the visit letter we have covered, and now I will talk about the next letter. So that is the letter to community health center. What happens again? It is all about, I'm not teaching you anything. I'm just telling you about the grammar stuff. That is the main thing. So suppose if patient was attending a community health center at Delhi. Now, and patient was living with his wife. His wife died and he is 73-year-old. Imagine 73-year-old wife has died. Then his daughter lives in Bangalore. Bangalore. Okay. Okay. Nice. Now what will he do? He is all alone, so he will shift to Bangalore. It can be due to any reason, maybe due to his daughter, or maybe suppose if he is living in a small town, say Cathal. It's my city, so don't say I'm against it. Okay, so community center at Cathal, and then suppose he had some serious condition like sorry, medical terminology is all about negative, otherwise I don't want to think anything negative. Suppose if somebody had cancer and you get to know there is very good treatment in Bangalore, okay, Bangalore, or you can say, or in Delhi. So it can be due to various reasons. So while he was in Cathal or in a small town, any small town, let's say it is, I take it a foreign suburb like Elizabeth. So he was attending Elizabeth Community Center, and now the daughter is living in Melbourne, suppose, and there the center name is Melbourne Community Center. So now what is happening? That patient had cancer and there was no good treatment over here because it was a small town. So he had to, so he has to move to Melbourne because of the treatment. So what I'm telling you by these are two different examples. So in one case, he might be moving because he's all alone. It can be psychological reason or the social reason, or it can be medical reason. So you have to find the main reason. So sometimes we always think that letter is all about medical stuff. So these letters are something in which it is given patient attending community health center at Elizabeth since 2007, and today's date is 2000 March. It is given 2011. Suppose. So now, what is the specific grammar that you can use? So now, when he is moving to Melbourne, obviously he will go to new community health center. Means what is happening is when patients are in their old age, they need community health centers. They go over there to spend time. They take medications from there. So in foreign countries, we have community health centers to take care of the patients who are old or due to other reasons. They can be mentally sick patients. They also go to community center. So suppose when patient was living in Elizabeth with his wife, he was all comfortable. He was coming to Elizabeth Center. But now when he is moving to Melbourne, so he will be attending Melbourne Community Center. So what, and you are a nurse over here. So you will write a letter to Melbourne Community Center to tell everything about the patient. Now you will tell everything. Now in this kind of letter, what special grammar is required? So this letter, again, I'm writing this letter or this letter is being written, doesn't make a difference. Main, the rest of the grammar would make a difference. So this letter is being written regarding Mr. X. Now this is the grammar who has been attending our community center since March 2007, whatever date has been given. Now, simple again, I'm not teaching you anything. I'm just teaching you which normal things you will do. But as you have OET as an exam, so that's why we get scared. but otherwise write as normal as you can. So this letter is being written, who has been attending our community center. So this is my grammar, has been ing. Again, you show this power. This is what we did in this letter as well. If you get the time, so you always write he has been having diabetes since 2000. Same tense, who has been attending our community center since March 2007. Now he is moving to Melbourne. As if the letter is of daughter, as his daughter lives there. Now the main line. Therefore, from now onwards, he will be attending your community center. That is nice. So I am telling the new community center that this patient was attending our community center. So you don't write about diagnosis, diabetes, hypertension. You talk about the main problem. So in this letter, you get engaged. Oh my God, I have to write diabetes. I have to write hypertension. No, you just have to tell the main reason. So who has been attending, but his wife has died recently. So now he is moving to, now this was the main thing. That is what was the main purpose of the letter. It is the purpose is that he was attending our community center, but his wife died recently, has died recently. So now he is moving to Melbourne as his daughter lives there. Now this makes sense. It's just about normal human mind giving the right reasons that his wife died and now he's moving to Melbourne as his daughter lives there. Simple connectors, perfect. There from now onwards, he will be attending your community center. Suppose if it was due to a diabetic complication, but now he has been, suppose he has the other thing we were talking about, but now he has been found with cancer. So he is moving to Melbourne for better access to the treatment of cancer. So that becomes the main line. So but now he was attending our center, but now he has been found with cancer. So he is moving to Melbourne for better access to the treatment of cancer. Therefore, from now onwards, he will be attending. So we are just referring the patient from our community center to a different center. Now, what would be the social history, medical history? Same. You will talk about the normal habits of the patient. Same tenses, everything same. Then you would be talking about rest of the things, whatever is important for the patient. In this kind of letter, you will write about the normal things. Patient is having this problem, that problem, you need to. And in this, say, you cannot write on first visit. You cannot write during hospitalization because it is not even during hospitalization. So whenever you guys are confused whether to write first visit or during hospitalization, whenever you are confused, the best thing is during our care. He was having these and these things. So when you write the past things, you include everything in this word during our care. Or if you want to write better, if you want to write better English, while being in our care. This looks very nice, very nice. During our care is also good, very nice. This looks even more having bit of X factor while being in our care. And while word can always be replaced with whilst, whilst, whilst being in our care. But why to write over? So while being in our care, he was having normal words. This and this problem. So suppose if he was having diabetes, he was having diabetes, so diabetic diet was given. So you have to be really, really simple. Suppose if you have already written about the diabetes over here, so why would you write again? So you will say during our care, diabetic diet was given. Normal, because you have written diabetes over here. So don't write again that he was having diabetes. So while being in our care, diabetes diet was given along with along with medications to control his diabetes. Simple, matlab it's all about flow. It's all about flow. This is the second type of letter. And then you say, once he shifts to Melbourne, he will be attending your center. And now it will become a simple discharge letter. I will put the discharge letter at this thumbnail now. So the last paragraph, now it will become a simple discharge letter. Once he shifts to Melbourne, M capital, he will be attending your community center. Now simple discharge letter, it will become. It would be greatly appreciated. For all the new people, I can understand, but I'm writing for all the people who are taking exam tomorrow. So yeah, so once he shifts, but you all can understand, it's nothing complicated. So you are writing from one community center to another community center. You write the purpose, you write about social history, medical history, you write about during our care happened. Now once he shifts, he will be attending. It would be greatly appreciated if you could provide him this and this thing. If you could, suppose diabetes, if you could monitor his diabetes and can provide him diabetic medications and diet. Now it's a simple visit letter. Kindly give him this and this thing, second line. And then we talked about third line. He needs to be given this and this thing. He needs to be educated about diabetes. And one line you can make further, he should be encouraged to walk every day. These are the 4 lines you create in discharge letter. Yeah. Further, he should be encouraged to do this and this thing. These are the 4 tenses you use in the discharge letters. It would be greatly appreciated if you could kindly do this thing. Third line, he needs to be given or educated. He needs to be plus third form, passive voice. Further, he should be encouraged for this thing. So that is how you write this kind of a letter. So please listen to these videos 2-3 times unless you understand them well. And if there is any doubt, you can leave the message. So these kind of letters, these 2 letters I'm suspecting because they are little different. And you know, when there are continuous or ongoing discharge back, referred back letter, when they have come, so visit letter or this kind of a different letter can come. This is Dr. Bhupesh from Dr. BKM OET Institutes. Thank you very much for your patient hearing. Thank you.